Have special women in our lives. Maybe it's your wife, your mom, your grandmother, or even yourself.
Tonight, we're talking about women's health for Endometriosis Awareness Month. Kayla Strayer introduces us to a Chattanooga doctor making it her mission to educate other doctors.
Endometriosis is more common than what you might think. Doctors say it affects about 10% of women. Tonight, meet one of those women. She lived in debilitating pain every month for nearly 20 years before finally getting it diagnosed.
Ever since Kristen Babick was a teenager, she's lived with intense pain and nausea during her period, causing her to sometimes miss school and work.
There would be days where I would have so much pain that I would just have to lay in bed through the day.
Throughout 2 decades and 2 pregnancies, it didn't get any easier.
Trying to catch up with your 2- and 4-year-old and play with them, and you're in pain and nausea all the time, it's, completely detrimental to your way of life.
I think part of the problem is young women aren't always listened to.
After some tests, Kristen was diagnosed with endometriosis. Tissue normally lines the uterus and is shed during a woman's menstrual cycle. But with endometriosis, the cells start growing outside the uterus and pile up. This can lead to cysts, massive scarring, intense pain, even infertility. There are a few options for treatment. Kristen chose the permanent route.
Within a month of seeing her, I'd had a hysterectomy, and I feel better now than I have in years.
If you have severe pain with your period, severe monthly pain, make sure someone listens to you, because you might have endometriosis.
Reporting in Chattanooga, Kayla Strayer, News Channel 9.
Dr. Molling has a grant from the Endometriosis Foundation of America to research the disease. She's looking at possible links between genetics and the environment.
The fight for medical marijuana moves forward in Tennessee. The medical cannabis